Once again, folks, welcome to another episode of Healthcare Today with HSA. I'm your host, Chuck Taylor, and this week is a special week. Now, every time I have these wonderful ladies come in here from HSA, it's always a pleasure and a joy. But this time we're talking about something a little bit closer. I know we've had doctors, we had the biolab come through, but now I say with all honesty, this is the backbone of all healthcare. We have Nurses Week, and I have two wonderful nurses in the building who's going to tell me your names and a little bit about you, and then we can dive right into it.
So my name is Karen Stewart, Senior Nursing Officer for Inpatients Units at the Health Services Authority. And I've been a nurse for 30 years this year. I am school by it. Love every minute of it because it does have its challenges. But it has been a good journey. This week is our week. We want to celebrate it with the public.
I am Linda Shepard, and I'm a Chief Nursing Officer back in the U.S., and I'm here working with HSA and partnering with them for Joint Commission International Accreditation, and so helping them through that. Been a nurse 38 plus years.
Let's just say this is a love and a passion.
It is.
And therefore, it makes time fly by quicker.
Yes,
that is true.
It does.
So I can't imagine doing any other career than nursing, and I've had so many opportunities throughout my life and been able to travel. I've done international mission work, providing medical care. And so just in all arenas, coming here and working with this great group of people, and then my job back in the States and having done many avenues of nursing, I can only say that there is something out there for everyone within nursing.
Not making light of the situation, but I think over the last, say, 2+ years, nursing has really come to the forefront with this pandemic that we've still in, and we're moving in a good direction, but we have to still be aware of it. The healthcare has been basically ravished with everything. I think in my lifetime, this is the most and probably the most complicated I've ever seen, especially for the healthcare for you ladies. It's put a lot of challenging situations towards you. And this is a time that we can, celebrate and let y'all be heroes as you normally are every day.
Yes, thank you. And, I think that is true for every nurse out there. No matter what your scope of practice is, no matter what you do, you're a hero to those individuals that you serve.
Exactly. So this is an annual celebration, and it's basically to showcase the role of nurses and also help raise awareness of your profession and also maybe get some new blood into it.
Yes, we want that.
Definitely. So tell me about, I don't want to say day to day because every day is probably different, but just give me an idea what kind of things you do there, nurse.
You start thinking about nursing and what you're going to do before you leave your house. Because really it set the pace for the day. And every day is different. The challenges are different. The rewards are different. The opportunities are different. And so to me, there's no boring, nothing is the same. So that is really inspiring. And there's always a story that inspires you when you go to the hospital. You're wondering what's coming through that door, what's coming through A&E, what's coming through ICU, what's coming to you on the ward.
And I think that is one of the things that people who are not wanting that same 9 to 5 day to day, and you have to be a real people person.
You have to.
You have so much. And for me, when I think of nursing, in the old days, it's always the white on white, but that's not the case anymore. When I walk in the nurses station, I'm like, you guys are the most colorful and happiest go-luck people, but it's all about business too.
For us, we want to provide, and we strive to provide consistent, high-quality care. We want when you leave our presence that you feel very valued. You feel, yes, you have come into contact with a group of persons who want to understand what you're going through, who can empathize, and then based on that, we can deliver evidence-based, real, genuine, and at the same time, loving care. So that you feel that you have been cared for. We show you compassion. And all those, we are able to show you that we can collaborate with other healthcare workers just to make sure that your journey today and your journey for tomorrow is going to be okay going through our healthcare system.
As I said earlier, I've had the ability to watch HSA grow to such a world standard. And you ladies and men, because men are nurses too.
Yes, of course.
I remember, growing up, it used to be, you want to be a nurse? That's a lady's job. But then it's an open field. It really is. And you just have to have a love of wanting to care and take people health seriously. Correct in saying that?
Mm-hmm.
Yes.
You are correct.
Yeah. And so tell me a little bit about some of the exciting things in the U.S., because that kind of is the forerunner for a lot of different policies. We look to that also in the U.S. and it's implemented worldwide. But how does that fit in with the Caribbean idea?
So I think it fits well. It's worldwide nursing. So I'm just going to share some of the impacts that nursing has had, as you may well know, over the past 2.5 years. Has been extremely challenging. Mm-hmm. And so Dr. Pam Cipriano is president of International Council of Nursing, and she's actually a colleague and friend of mine from the States. But she highlighted in a recent article that, quote, nurses have suffered tremendously throughout the pandemic. They've been unnecessarily exposed to the virus, faced attacks from the public, suffered from extreme workloads, and continue to feel undervalued. If governments put off investing in healthcare workforce, it'll be to the detriment of healthcare systems everywhere. And so in the States, we're looking at it really as it's an international healthcare crisis. So back in 2012, the nursing shortage began. So I don't think a lot of people realize that.
Right.
And so the pandemic only pulled back the curtain and exposed what a nurse's work life is like, and actually the current situation of nursing. And so during these uncertain times, the nurses have been fraught with, once again, excessive workloads, as we've had tons of patients come in. Either they had COVID, been exposed to COVID, mounting demands from patients, families, friends, and other entities. Because COVID, and anybody that has lived during the COVID, you'll understand this, people changed who they were. Mm-hmm. And so at a time when I may be gracious, this may not be a time when you're going to be experiencing that from me. And then ongoing alterations in the healthcare roles and responsibility. And nurses were redeployed from areas of primary care to other areas and back and forth.
Right. So it was a constant moving and basically a shuffling of resources.
It was. It absolutely was.
Yes.
And so the physical and psychological safety concerns have evolved and are very high on the radar in the U.S. at this point in time relative to the pressure that it has created on nursing and the whole landscape of COVID itself. So people have had difficulty coping and then also being resilient amidst feelings of moral injury, trauma, and exhaustion.
You hear about this in other fields. And when you say trauma, I'm thinking police, I'm thinking high stress. I wouldn't think nursing as a high stress, but because of the pandemic, it showed that it has been and continues to be that.
That is correct. And so when you looked at what happened was as nurses, so as we got into the pandemic, what we saw and experienced, that there were nurses that were leaving the bedside because of the stress of the pandemic. So duty to patient, duty to family. Mm-hmm. And so making those type of decisions.
That's a hard choice.
It is a hard choice. And then as patient volumes continued to grow, it was that day in and day out, you were seeing people dying before your eyes. Our own facility that I work at had 475 deaths during that period.
That's a war. You're talking war numbers now. You're talking front line. We here in the Cayman Islands have been lucky. Mm-hmm. We've heard the impact. It hasn't been that detrimental, death toll wise. Mm-hmm. But I can't imagine hearing and seeing weekly stuff like that. It has to affect you.
Oh, it's daily, and sometimes it was multiples a day. And the nurses would cry, and I would oftentimes go to them and say, "I'll take your patient load, so you can get a break." And the response was, "No, I have an obligation to my patients." Mm-hmm. And so it was that duty, even though they had just suffered, they'd lost a patient, they were feeling that they needed to go back and take care of others. And so when you start that, it kind of creates that moral distress. And that's, the right thing to do, but, because of constraints, it may be difficult to carry out, or the moral distress doesn't get resolved and you go to moral residual. And so as things remain unresolved, the emotional conflict continues to grow. You're putting extra shifts. You're having to do even more extra shifts because the people have left their post. And now you're filling in, not only doing your shift, but their shift. The volumes call that you have to be on and continue to work. So it could be typical people work 7 days in a row. And then you have the moral injury, and that's one's moral framework kind of gets eroded. And then it can either erode by a single incident or by persistent incidents over time, is what we call trauma. And then it leads to burnout. And then you have to disassociate yourself with all the problems around you, and you just kind of go into emotion of existence.
Just dealing with it.
Just dealing. You try to ignore it. You just go with the flow.
Wow.
And it's, there's a lot of literature out there about burnout, but I can say that I've seen it exist in nurses. I've seen it at times in myself. And so it's trying to teach nurses going forward, how do you take care of yourself? How do you get yourself not into any of these situations? And what can we do to help protect you?
I think that probably is one of the hardest things, because over the course of time, nurses have been so selfless, giving, and not thinking, well, how is this affecting me? When I get home, I'll de-stress with it. I'll deal with it later. But then you don't get to go home. You're, as you said, you're on call. You're not sleeping properly. I know, just being in radio, when we have a crisis, say hurricane, for lack of a better word, we're on call. You're sleeping with the eye open, and that's just for a few days. We'll be on call for this. It's 14 days hurricane back to back, bad weather. 2 years of bad weather is a hard thing to even fathom.
So as Karen said, when you're getting up in the morning and you're thinking of your day, so here's the extra complexity that the nurses had and healthcare workers during the time of COVID. You're not only concerned about that, but what's going to happen. There's uncertainty. Every day, the information in healthcare was changing. So you had to adapt and roll with it. Every day, you didn't know how many patients you were going to have. Every day, you didn't know how long you were going to have to work. And so
that's a lot. I mean, I've been in PPE for 2 or 3 hours, and I was exhausted.
Right.
I was literally, my mind was shutting down on me, and I was like, dude, I can't stay here any longer. I got to get out. I can't imagine a nurse being in there for an 8-hour shift, 12-hour shift. Mm-hmm. That's hard. That's really hard. And we don't think of it until you start putting it into perspective. And I'm sure, Ms. Karen, you can, Cayman is, we had the luxury of kind of dealing with things, but then you girls have, in Jen, have been stuck. I mean, there is no second shift. There's no bringing in somebody from another hospital.
That was a challenge because, unlike the U.S. or some first world country that has a pool that you can pull from, we had no pool. So I'm sure, as being one of the main hospitals on island, of course, we had to deal with pulling nurses from everywhere, doing extra shift and those things. But we work as a team, and therefore we protect each other. Mm-hmm. We pull each other. We encourage each other. We held on to each other. And that is why this week we wanna appreciate nurses all over the world to say that we see you, we hear you, we appreciate you. You are valuable to the health organizations. Nurses is like the biggest workforce in terms of clinicians. Mm-hmm. And so, therefore, we want to just say, Happy Nurses Week. We want this to be your week, but we want also the public and everyone to understand that we are here to stay. We want to be a part of decision-making process, in not just in our healthcare, but we, as a nurse, we have a wide spectrum and a big scope. You'll find nurses at every level. You'll find nurses in the public in both the political arena, because we make decisions as to
Yeah.
global health as well.
Policy.
We speak to, we advocate for that, and our theme this year points to that. And as you know, Florence Nightingale is where this all started about Nurses Week. The lady with the lamp.
Just gonna come to that. I was just gonna come that.
She advocates as well, so we're doing the same thing.
And why was Nurses Week created? I mean, we know that, nurses, at least now we see nurses as a foundation and a mainstay within public health, private health. I mean, literally, you ladies and gents are the first line before we see the doctor. You're the triage. You have everything knowledgeable to pass on upward to make decision. So why was this week created? Give me a little history with that.
So to understand Nurses Week, as I said to you before, we must understand, and we must start with Florence Nightingale, the lady with the lamp. Florence Nightingale she was an English woman and a volunteer in the Crimean War in the 1850s. She advocated for the rights of men, the importance of making sure that they had good sanitation, good nutrition, so that they could fight the war and do well. Therefore, she advocated for better care, which is important. In today's world, we as nurses are doing the same thing. And so Nurses Week was created because of, in remembrance of her.
Okay.
And then Nurses Day is the birthday of Florence Nightingale.
And it comes full circle. So Nurses Week actually ends on her birthday.
Correct, every year.
So
Okay,
May the
awesome.
12th is Florence Nightingale's birthday, and it's to remind us of ourselves that from our humble beginnings to where we are now, and the whole passion that she had for better care.
Right.
And we continue to strive to that by doing evidence-based practice.
Of course.
That's very important to us, just to ensure that we provide the highest quality healthcare to one and all.
When you ladies were coming, I had to do a little bit of research, because I was like, we see nursing, but we don't know that there's a very stringent schooling process that you ladies and gents, and I keep saying ladies, but nurses go through as a whole. And the first professional nursing school was created and founded in London under Florence Nightingale, if I remember correctly.
Yes.
But give me a little bit of a nursing. I mean, I'm not trying to date you, ladies, but just what a nursing school might consist of.
So it's rigorous, and I'm going to step back before I answer because I've got a little tidbit, and Karen probably knows this, but I think the listeners may appreciate this. But Florence Nightingale, actually, when she was there in the war and working, she was observing that surgeons didn't wash their hands between patients. And so she realized that these patients kept getting infections, and she didn't know why. So she was like one of the first people in quality looking out, and Karen talked about evidence-based practice, that you needed to wash your hands between patients. Everything needed to be sterilized. So she is the person that actually started all of that.
And that's so funny because in radio, we have a policy when one jock leaves the station, when we leave the air, we kind of make sure rub down everything. And it's so funny to think that we never did that before, but over the years, just because, somebody's cough or someone's sick and you just try to do that. So now that we're in the pandemic stage of life, we do that constantly.
Right.
But it's based off of the first one who actually saw evidence-based, hey, this is the reason why we should do this. So
very
full
interesting.
circle.
But back to your question about schooling, very rigorous. Karen would agree with that.
Yes.
So there are many avenues that you can go into if you want it to be a nurse. You can go to a technical school, or you can get a associate's degree in nursing. You could get a bachelor's degree in nursing. Master's degree in nursing. It's difficult to get in the schools. And so a lot of that has to do with there's testing that you have to take to be able to get into the school, because the study and curriculum is very difficult. Actually, my curriculum, when I went to school back in the day, it was, we actually studied with the pre-med students. So we took the same anatomy and physiology and chemistry classes and everything and biology classes that they were in. And so you've got to think about that. So it's a lot of rigor.
That's a lot of work.
It is. But the passion goes with it. If you feel that and that's something, and as we both said, it's been a rewarding career for us both.
Okay.
It's just trying to get through that. And here's the thing, we need more nurses. So we talked about the nursing shortage and the nursing crisis, and it's going to get worse. So as people in the States, what we're seeing is as people have had time to take maybe a breath, they're looking at what their other opportunities are. And for nursing, there are so many. There are areas of innovation because nurses are hugely creative. I can only tell you what I've seen them do before. And so creativity, working for insurance companies, working for attorneys, grooming through charts and helping them prepare legal cases. There is so much out there now that a nurse can do. It's no longer that you either work by the bedside or work in an office.
Right.
That's no longer the case.
The door is open.
Correct. And as people see that the hospital situation and what people have suffered, we saw exit. And actually in a report I read last week from Becker's Healthcare Review, it said that last year 100,000 nurses left the United States as far as they left their profession. They didn't leave the States, but they left the profession of nursing. And so they're making decisions. Do I stay? A lot of them have gone into other career paths. Some of them are still in it and trying to decide what they want to do. Is this right for them? But as we look at this, then we don't have a lot of educators either. So you can't enter people into programs where you don't have people to educate them.
True.
So there's multifaceted issues as to why we are where we are. Unfortunately, no one saw it coming. It was out there. I think nurses preached about it for a long time, but it wasn't recognized at other levels where action could be taken.
It needs to be on a higher political level to say, hey, you know what, let's do incentive programs to try to enhance the nursing field. I mean, we hear that all the time. Oh, such and such school of electronics they're doing these. I when I went to school, it was a rare thing to see someone who was becoming a nurse. Now, med school, you always hear, oh, I'm studying to be a lawyer, a doctor, but you didn't see that very often. And now is a time that we're paying for it.
Correct. And so what's going to happen if action's not taken? And I've shared this, Karen knows this, but I'm president of the Virginia Nurses Association. So what we do is work with our delegates and senators for legislation. And so hammer that out to see what can be passed. And so we got actually from our association got 3 bills passed last year that will help nursing. And one of those was a forgiveness loan. So if you go to school, the government will forgive your loan if you're in the state of Virginia, if you go to be a nurse.
And that's just it. I was reading that the International Council of Nurses, that you've been in existence since 1971.
Yeah.
This is another way of advocating. Say, hey, policymakers, listen here. This has been coming for a while. Okay, we're here now. Now you realize that, hey, you got to scramble to do something, but you're the voice that has been preaching and shouting this for a while. They just need to listen and take action.
Absolutely. And I think that's the struggle. From a nursing perspective, you feel a little bit deflated to know that as you look down the aisle, here comes the hurricane towards you, and you can't do anything about it because you can't get anybody to partner and help you fix it. And now here's the issue. There are no quick fixes. There are none. And so as the U.S. and other countries, they're starting to pick nurses from an international level. Well, that will just pull out the nurses from areas like here and other places in the world. And so all we're doing is moving those small amount of nurses around.
Rather than influxing new blood into the system.
Correct. And then even if you do that, you have to have the school support. You have to have the means for people. A lot of very bright people maybe can't afford to go to nursing school. And so being able to help those individuals get that accomplished also.
And the theme for Nurses Week for 2022, what's the theme of it this year?
So the theme is A Voice to Lead, Invest in Nursing, and Respect Rights to Secure Global Health. And this focus on the need to protect, to support, to invest in the nursing profession, to strengthen health systems worldwide. So we continue to promote the work of nursing, fight for nurses' rights, for a safe working environment, so very important. You don't want to feel threatened being in your workplace. So we are fighting for that, for decent wages and for full participation in decision making. As I said to you before, that decision making piece is very important because it's about how it's going to impact nursing now and nursing in the future. And how nursing is impacted will also impact our public. And that's very important. That's very important. So we're encouraging through career fairs, attendance. The Health Services Authority also have a summer volunteer program, a summer student program, which we bring students in so that they can get a feel of the healthcare system and they can make a choice as to which clinical area that they would like to specialize in or to go in when they leave school. That's an opportunity for us to showcase nursing in that area. And so it's things like those that we have to promote to make sure that we have people for tomorrow to look after you and myself when we get older. But we want to also ensure that that nurses have safe working environment and decent wages. We find that nurses tend to leave from one area or one country to better themselves somewhere else. So in order to keep the nurses where you want them, you need to make sure that you're looking after them. So that's very important.
And I think one of the things that we keep mentioning the pandemic, but the pandemic sort of turned on the light on a lot of issues.
It did.
And one of those issues is public health is not in the hands of politicians. Public health starts on the grassroots level of, say, nursing, people who are the first tier to say, hey, you know what, I'm starting to see this type of problem arising. This is something I'm seeing constantly over a course of time. This is something you should be aware of. This is something you need to take a look at. This is something that you can fix by doing these things. And I think, I would love for that to be one of the sit-down things that the power, the powers that be, we talk about the politicians and the policymakers actually say, hey, let's bring in the Council of Nurses, let's bring in the Nursing Association, that we can find out what some of the challenges that you have and some of the concerns that you have moving into the future, that we can adjust to mitigate some of these before they become crises. And I think that would be something that, should be adhered to in the future.
Oh, absolutely. Yeah. And I would only say, and this is just, I'm not going to date myself, I hope, but when I started my first job out of college as a nurse, I got paid $11 an hour to work in a level 1 trauma unit that we procured organs on patients. We did everything. The plane landed or the helicopter landed on top and they brought them straight down. And so when I think about that, nurse salaries haven't increased a whole lot over that 38 plus years. And so when you think about it, I know my husband works for a corporation and they build trucks. And their workers on the front line who don't have the education that the nurses have get paid more than some of the nurses start out in salaries. So I think that's a social commentary on where we kind of put value and sometimes where we put our dollar.
And I think that's so true. It's a disservice not to respect and also understand that this is your life that someone has in your hand. That this is somebody who is taking the time to study to make sure that you have a better existence. And kudos to you ladies for International Nursing Day. I mean, if nobody else says it, I will say it. Thank you so much for your service.
We have had many persons say it, which is great.
Yes, but I always like to hear it.
But we still want to hear it.
I'm so happy that you stopped by today. You're tuned into Healthcare Today with HSA. I have some wonderful guests here with me. Please introduce yourself again for our public.
So I'm Karen Stewart. I'm the Senior Nursing Officer for Inpatient Units at the Health Services Authority.
And I am Linda Shepard, Chief Nursing Officer back in the States, and I am here working with Health Services Authority as their JCI consultant.
Talking today about International Nursing Week. It's Nurses Week, they call it, but it's international, it's global. It encompasses nurses worldwide from all walks of life, all languages, all customs. Yes. This is their time to shine, and it happens and convenes on none other than Florence Nightingale's birthday, which is May 12th. So the week prior to May 12th is all about nurses. Correct in saying that?
Correct.
Yes, that entire week is usually all about nurses.
So
We have celebrations.
the celebration, and that's what I want to take a closer look at. The theme this year, it speaks to so much. Just give me an idea once again for the theme for this weekend. Some of the things that it speaks towards. I know we had started digging into it a little bit to talk about how we can strengthen healthcare systems worldwide. Well, how do you see doing that in the future?
So, the one of the things that that the theme also that speaks about is trying to build a resilient, highly qualified nursing workforce. That's so important. That's the investment piece as well. And that's going to be building through partnerships with our local politicians, those at the grassroots, and also internationally, globally. And so we want to transform the health system to meet the needs of individuals and communities now and in the future by protecting the rights of nurses to transform. That's the only way it's going to happen. And so this week, as we celebrate Nurses Week, there are going to be different ways that it will be celebrated in different organizations. So it will not just be Health Service Authority, or the hospitals and health institutions will have their way of celebrating it. The Health Services Authority has, of course, always looked after the nurses. And so this year they're sponsoring a Lunch and Learn at the hospital event. We'll be having the Honorable Minister as well. I'm Sabrina Turner there as bringing greetings to us. We'll be having a lecture on nurses burnt out, causes, symptoms, and prevention. And then we'll also be having not just lunch, but a self-care workshop with massage therapists, to give us some tips about how to take care of ourselves and to give us a few massages as well.
That's always
good. And of course, we don't want to forget the islands, because they're important as well. So they'll be having their luncheon, and we'll be doing live streaming. To make sure that they get the tips as well, that they get the lectures. Yes, our sister islands. We cannot forget Cayman Brac and Little Cayman. We do have nurses on those islands as well.
Excellent. And that's one of the things I think that you forget too when you're in that high stress environment is you do need a little time for yourself. You do need a little break time. You need to recharge yourself. And recharging yourself, despite what you think, education is always key. We're never too old to learn how to take care of ourselves. And I think, that is an excellent thing that the HSA is reaching out to. Miss Linda, let me ask you, what do they do in the U.S. during these times? Just a little toss up there.
Very similar. So usually at my institution, we'll have a large lunch or dinner for the nurses. We recognize them. So we have several categories of awards. So one that's dedicated to patient experience, one that's dedicated to quality, one that's dedicated to risk management, and recognize those individuals. The nurse managers typically will take some money out of their budgets and create baskets. So we have as many as about 70 baskets that we raffle off to the staff so that they can have those.
Nice.
And we've actually done a video in the past just celebrating the nurses on the lawn of the hospital.
And I think, if there's anybody out there listening in Radio Land, I know you guys got a little spare change. You might want to just stop by and donate something into them so that, it can be nice. And it doesn't have to be this week. It could be next week. Say, hey, I missed you last week, and drop it off. Show some love and appreciation for these wonderful ladies.
And I mustn't forget to mention, thank you, Mr. Mark Antony. He owns, I think, Burger King and Popeyes. Well, they will be giving us breakfast on Friday morning.
Nice.
So we want to make sure that those who are coming off nights are also looked after as well.
Awesome.
So thank you very much.
And that's sometimes we forget that this is a 24-hour experience. When one stops, it does not stop. It continues on. As they say, the bus continues on to roll. And this is a global thing, folks. So, wherever you are, because I know we have some international listeners, if you see a nurse, say hello, tell them congratulations and thank you so much for your service. And just, show them a little bit of love. That's always good, no matter where you are in the world. We were talking about the theme, and because the theme is worldwide, how would you say the pandemic has has kind of changed the way nursing looks at things. And I know we see it from the outside looking in, but nurses are on the inside looking out. How do you ladies see that?
The nurses, it's just been a huge struggle for a lot of the reasons that we discussed earlier. But, part of it is there was some anger, too, with the public that didn't choose to follow the pathways that were set on governments and institutions with regard to mask wearing. And we saw a lot of that in the U.S. And then just feeling abandoned. So it's like I'm here, and it's not like the nurse had the focus on themselves, but part of it is you give and you give and you give and you give, and there is nothing left. So when you go home, there's nothing for your family and there's nothing for you. And so it goes back to the whole comment on resilience that for a very long time, and I'm sure Karen would agree with me, I worked in level 1 trauma, and many of our patients, more of them passed away than stayed alive. And so it was always, how do you deal with those situations? Or you'd see such horrid things. And no one really knew about resilience and burnout and what effects that has. And so the pandemic opened that back up again. And the best advice I would have, and I'm looking at my own institution and other institutions, but in the U.S., we are trying to persuade healthcare organizations to take resilience education, make it part of your onboarding process.
Okay.
Underpin that and have psychological services available for nursing and staff that they can reach out to, not EAP, something higher than that.
Right.
And then have those policies that the hospital and organizations have continue to support that, but also teach it in school so that when nurses come out of school, they'll know how to manage themselves better so they can take care of themselves better than we did.
Yeah, and I think that's the understanding that right now it's an opportunity for growth learning.
It is.
And that's on both sides of the fence.
Yeah.
It is.
Yeah.
It's on the side of the policymakers and also the schools, and to say, you know what, that the training for me has always been we learn, but then we also project. So what the nursing situation has projected is that there has been a need for this. It doesn't wake up and say, oh, I need this. This has been ongoing for years. It's just that now, our core nursing ability has been broken. There is a missing piece from the puzzle. And, you kind of like, I used to tell people, I said, I come to work wounded sometimes. I'm hurting. I got stress at home. I got a headache. I feel like I'm broken. But I open up the mic and I got to be happy. I got to be the voice to get you to where you need to be happy. But then where do I go now?
Correct.
And that's how I see nursing at this point in time. They need help. They need support. They need structure on the side of the support. Tell me a little bit of how you were mentioning that earlier, the resilient, the highly qualified nurse. How could government help out in that vicinity as far as funding? What would it take?
Yeah, and some of it is funding, because as we ask and lean onto organizations to do this, because really you're investing in your future. It's a strategic investment. It's not that you're just putting money to something that is just going to go by the wayside later on. And in order to maintain the workforce that's there and the workforce for the future, I'm not sure that there is any other answer. Because if we don't address these items, we'll continue. It's, like the old adage says, what is the definition of insanity? Doing the same thing over and over again and expecting a different result. So somewhere along the way, the cycles have to be broken.
And I think the people that are listening here, it starts just by someone saying, hey, there is a problem. There is a problem. There needs to be a resolution to it. So how do we find that? And part of it is an open dialogue.
Yes,
They need to have a conversation with you to say, hey, all right, I hear you screaming. I hear you're upset. What are you upset about? We're upset because we don't have the resources to do this particular job. And in other places, if a mechanic doesn't fix a car, the car doesn't run. But if you don't fix something, someone dies.
Yeah.
Right.
That's the reality of it.
That's correct.
If you don't come to work because you can't or you're not able to, or you physically and mentally are at that breaking point, what happens then?
Right. And then what happens is everyone else is picking your load. And so all that does is exacerbate the stress on those individuals. And if there is no backup plan or immediate way to get people in there to support that, then those people may go away.
Mm-hmm.
And then you end up with a dissolved system. And so then it goes into healthcare. I mean, you're just in critical crisis mode. Absolutely.
Wow. Once again, folks, we are here today. It's Healthcare Today with HSA. Yours truly, Chuck Taylor. I'm talking to Nurse Karen Stewart and Nurse Linda Shepard, all the way from the U.S. Well, you're local.
Yes, I am. Yes.
And Ms. Linda from the U.S. here. We're talking about Nursing Week. This happens internationally. And so I was talking, and I've had wonderful nurses take care of myself, my family, my daughter, and how can I kind of give to the nurse, give a little love, show them my appreciation. How can I do that locally, internationally? Just tell me, how's that possible?
Thank you notes are an excellent way. Nurses love to receive those back from their patients. I said earlier, I worked in a level 1 trauma unit, and for any patient that ever left us walking was a miracle.
Mm-hmm.
And so just to be able for them to write back and let you know what an impact you had in their life. On an international level, there is such a thing as the DAISY Foundation.
Okay.
And the DAISY Foundation was started many, many years ago. It was started by a husband and wife team in honor of their son who had been hospitalized for quite some period of time with an autoimmune disease. And unfortunately, he did not survive the disease. But for the couple, it was making sure they wanted to recognize nursing. And it was not to offset in the other services that other healthcare providers offered, but it was to say that this nurse is at the bedside 24/7.
Mm-hmm.
They held our hand. They cried with us. The days we found out the news, they were there and supported us. And so it was that ongoing piece. And so nurses from around the globe can be nominated for the award. It's actually, once again, through the DAISY Foundation, and hospitals need to belong to the DAISY Foundation for that to happen.
Mm-hmm.
But they get an awesome, they get a certificate, they get a DAISY bag. So the DAISY was representative of one of the son's favorite flowers.
Mm-hmm.
And then also they get a statue, and the statues are actually contracted with a company in Africa, and all of them are handmade out of stone.
Oh, nice.
And it's called the Healer's Touch, and it's really a nurse embracing their patient.
And that's one of the things that I think, because as I said, nursing is a 24-hour job. People, and not make light of any other healthcare profession or, anyone else in the healthcare system. But I've literally, I had, I'm sure we all had someone who is sick intensively, and you're almost by their side and you fall asleep, and someone comes and put a blanket on you, and I'm thinking, this can't be the same person. I've been here 12 hours, and it is the same person. And then they switch, say, hey, you should go home. When you come back, someone is there, and there's the same level of care, the same giving, and that's thumbs up to the organization of nursing, that it's equal. It flows continuously.
It does.
In a lot of ways. Ms. Karen?
And sometimes storytelling,
Mm-hmm.
you want to tell the stories. You've experienced it. Let others know about it.
Mm-hmm.
And it's be like at the hospital when we get a story. It's your story, but you're sharing it with us. You have been in our care, and we share these stories with the nurses and even in the other departments, because then it makes us know that, listen, this person really values us. They really appreciate us. And the next person who comes through that door, you remember that story, and you want their experience to be even better than the last story that you heard about. The storytelling is really a good way. And even as your children grow up, you can tell the stories to them. It might just change them to want to come into nursing. Initially, when when I was in high school, I didn't want to be a nurse, but something happened to me as I was about to graduate, and I can't tell you what it is, but I started to love people to the point where when I got my first job, it wasn't in nursing, and I was getting a scholarship to be a chemical technologist, and I turned that down to go into nursing school.
Okay.
That at the time, many persons thought, you're going into nursing? That doesn't pay. But something happened, and I just really wanted to do something for people, and it has not changed.
The passion.
So those storytelling, it builds passion, and it changes people's life. So tell the stories. We want to hear about it as
Nice.
well.
And although the quote says, and I can't remember who says it, but they may not remember your name, but they will always remember the way you made them feel.
Exactly.
And I've been in the grocery store before,
Here
and I
it is.
had a lady come up to me and she hugged me. And I try not to act like, ooh, you don't want to act like that's offensive because, they may know you. So this woman, I remembered her very distinctly. Her son was in an automobile accident, and I had taken care of him so many years ago. I mean, her face had faded from my memory, but mine had not faded from hers. And so she wanted to let me know how her son was doing now, what he was up to, and she was just so grateful for the time and the care. And she said, what I always remember about you, you were always very soft-spoken, and the fact that you would always hug me. And she said, you never seemed fearful to hug me.
True. And I think that's one of the things that people globally, the level of care and the level of love that nurses give is unheard of. I mean, I've been in cold rooms and a nurse walks in and there's a light that comes in with her. When they say, well, the doctor said, and once again, folks, I'm not saying anything, but I've had doctors tell me things and I acted like I understood and I did not understand a word of it.
You're not the first one, but keep
And the nurse broke it down in a closer to home manner that made me understand. So the next time I was like, yeah, doc, I understand. And I said, what did he say to me? And she's like, oh, come here, let me tell you. Let me show you what this medication really does. They break it down in a way that was closer to me. And it wasn't that the doctor was so above it that I just felt more comfortable hearing it from her. It felt like a family member talking to me. It felt like someone that ate and taught. I just felt like this is a person I could relate to. And I think that's one of the kind of superpowers that nurses have across the board. And you could be anywhere in the world. It seems to be the same. They call it the old time bedside manner.
Yes. Oh, yes.
But I definitely, think that is one of the things. I guess it can be the saving grace or the passing on, but it seems to be one of the powers that has been transforming nursing to this, family networking that you ladies and gents have over the course. Let's talk about, earlier you talked about the INC president. Tell me that again. I want you to kind of dive into that. Dr. Pamela Cipriano, yes.
Yes. Dr. Cipriano, excellent individual. I actually have known her from the States. We actually have served on, she was the president of the American Nurses Association for a long period of time, I think about 3 or 4 years, if memory serves me correct. And then she went on to be president of the International Council of Nursing. So her experience and knowledge is very vast in the area of nursing, very, very educated. And so she also strives and stands for all of the things that we strive and stand for every day. And it's, once again, people in those positions are trying to create that uniformity among nursing and saying sometimes what people on our level, that people don't hear us. They don't either choose to hear us or they just don't hear us. And so from her standpoint, it's being able to be the voice for nursing.
Exactly. As I said, the exposure to this pandemic has changed people's opinion. It's changed families. It's changed a lot of things globally. And I must say, one of the things that I have said, not just from watching the news, but just overall, is it kind of put a level playing field for nurses, where now people actually said, "Hey, what do you think? How do you see this panning out? How do you, what are your thoughts on this matter?" And I think that's a great dialogue to have.
It is. The other thing when I think about that, as I look at the nurses and across that span of time, the nurses were trying to educate the public. A lot of our nurses even got on Facebook and just other YouTube and were, encouraging people in the science of what was going on and trying to help them understand in a manner that may not have been conveyed in the same way.
Right.
It may have been, as you said, on a little bit different level, but they would put it in the context of this is what you need to understand and this is why. And so as the pandemic unfolded, then I know in the U.S., nurses were trying to get the public to understand more and more about what they did, because it looked like that could be a platform for getting our voices heard even more,
Right.
where we felt like sometimes they'd not been heard before.
And I think and Miss Karen can help me with this. We here are such a small community. It's a small town kind of mentality. So what happens is over there. We don't think about it, but due to this being everywhere, now the nursing establishment here had to deal with it. Tell me a little bit about that, Miss Karen.
Yes, but COVID-19, it didn't just expose the weaknesses in our healthcare system, but it also exposed weaknesses all over the world, global health, health system, and the underinvestment that many people may not have thought about in the healthcare system. And even with us, the fact that we are an island and supplies, we don't produce many things here.
Right.
So even in terms of the supply chain, it came and it hit us full force.
Right.
How do we get PPE in, the PPEs in, and we need them and so on. So those things really, the supply chain and the procurement issues really, it came forth. It brought it so real to us, but not just us, as I said, international, the importance of having your supply chain and the importance of listening to your clinicians. Nursing, as Linda has been saying, has been talking about some of these things, but the pandemic, the COVID-19 pandemic exposed these things even more. So even at the political level, at the global level, in terms of policy making, it had to change. Because remember now, what affects here doesn't even just impact here, but it impacts globally the other countries. So that was brought to the forefront. And I think nursing came at the forefront with it to say, hey, we've been talking about these things. Now it's time to listen and let us all work together to try and find solutions.
And that's, to me, is probably the saving grace, because no one I dare say thought that this would ever come to this stage. Correct. So it sets up for, it was always, oh, well, something happened in that country. Something happened over there. Okay, yeah, that's understandable. We wish them the best. They'll sort it out. Now it's the world trying to sort it out. So when you hear of agencies, nursing agencies talking to other nursing agencies, well, how are you dealing with this? How is this working out? What can we do to kind of combat this going on our side also, because everybody is equal at this point in time.
Right. And the huge competition when you talk about nursing, the wage war that was going on out there. And here's the reality of it all. A lot of our nurses left our own organization to go travel, even though they were doing the same work they could have done with us, but the money that they were chasing. And then once during the 2.5 years they found out they could do it, what's the incentive to come back now? Because I have found out that I can do that. And so I think that is an interesting thought process that we all need to kind of marinate on. And I know for myself, and Karen can speak for herself, but I've gone back to school and hold my doctorate degree this December. And so part of that is I have done it because nursing is a lifelong learning profession. But the other reason I've done it is because I want to prepare myself to be a more active voice for nursing.
Yes.
And that's the love of it. Continue growth in your organization for the incoming into your organization. You've seen, you heard a lot, so you're willing to pass that on and also protect future generations coming in.
Correct.
I'm thinking of my daughter, she wants to be a nurse. She likes biology. She's thinking, hey, some ideas of how she can get into it. We talked about the services over at HSA, their summer program. Anything else you can add to that?
So UCCI has a nursing program. It's a bachelor's degree. So we encourage people, go on down and find out how to get into this course. What is it all about? It is a start. And the great thing is that Cayman Islands now have a nursing program so that the island can support nurses. You can support the nursing school. You can even support nurses by setting up, foundations so that they can get to do specialized courses, because as you know, that's the starting
right
with UCCI, but nursing is expanded into many specialty fields, and you still want that. So I want to encourage the young people who are thinking about their career choices. Go down to UCCI and find out, when they're having the career fairs, attend those. Find out what is it all about, and then get involved.
I think about people going into nursing and preparing themselves for those type of careers. And my prayer is that everyone else from an organizational standpoint will come alongside and address a lot of the issues that we've discussed so that we can gain those nurses and keep them in the future.
Exactly. Ladies, thank you so much for stopping by here today. It has been my pleasure. It's been my honor to have this, frank and honest conversation with you. You want to say hello to anybody out there in Radio Land before we wrap up here?
I just want to say Happy Nurses Week to every nurse. I want you to know that we appreciate you, we value you, and this is your week. Be the best that you're always is.
And I would like to echo that sentiment and say, woo, ladies and gentlemen, thank you so much for everything you do each and every day. You are really the backbone of healthcare, and we just appreciate you more than words can say.
Sounds good. Don't forget, folks, we are celebrating Nurses Week. And don't forget the theme for this week, for Nurses Week 2022, the theme is A Voice to Lead, Investing in Nursing and Respecting Rights to Secure Global Health. My name is Chuck Taylor. I hope you had a great one. Look forward to doing this again. Tune in again for another episode of Healthcare Today. Compliments of our friends over there at the HSA. Take care. God bless.